Now, you heard the thoughts of Dr. Becker about when to call a code, but let's now move on to the next question of what happens when you get someone back. After all, getting someone back is a big challenge, but once you've restored blood flow, there are other problems. One of the big problems we face is concern for brain injury and brain recovery. Patients after cardiac arrest remain in a coma often, where they are not waking up, sometimes for days. And you may recall from our lecture on therapeutic hypothermia, this time period after we restore pulses is a crucial time period during which damage occurs and treatments can be given. While we're treating patients after cardiac arrest, all families ask us, will my loved one wake up? That is their number one concern. They look at their loved one lying in bed, not moving, not talking, and they think, gosh, am I faced with severe brain injury here? Or is my loved one going to wake up and go home with me? And we all remember, and I've referenced this in an earlier lecture, the case of Terri Schiavo. Terri Schiavo was a young woman who had a cardiac arrest in the state of Florida some 15 to 20 years ago. The problem with Terri Schiavo was she had a prolonged cardiac arrest event, and although her pulses were restored and she quote-unquote lived after her event, she was in a coma or near comatose state for the rest of her life. And there was a very large and unfortunate political issue around whether she was truly brain dead and whether care could be withdrawn and so forth. And certainly I don't wish to wade into that controversy. I just point out that she was a clear-cut example of someone who had severe, unfortunate brain injury after a cardiac arrest event. And that image, I think, is indelibly burned into many of our memories and thoughts around cardiac arrest. None of us want our loved one to end up brain dead. After all, we'd have almost rather have not gotten CPR if this would be our fate. And so this is a big issue. And a question comes up, is there something we can do for families so that we can tell them who will recover? Is there a way to, and the technical term here is neuroprognosticate, is there a way to prognosticate who will wake up and who will not? It's a big question. And there's been a lot of research actually looking at this. One set of investigations have looked at brain monitors. For example, there's something called electroencephalography, or EEG, where you measure brain waves. There are actually invasive brain probes that can look at chemistry and cell function inside the brain, oxygenation inside the brain. There are infrared scanners that can be used. There's ways to sample brain chemistry. So there's a variety of brain monitors where you might think these could be used to look at brain function in a comatose cardiac arrest survivor to see who might have a better or healthier brain and who might have a sicker brain. Well, despite a lot of research over the last decade, we're not there yet. No brain monitor has been shown conclusively to be useful in all cases of cardiac arrest. We, in current practice, use a combination of these things, especially EEG and a few other brain measurement techniques to look at brain function. But it's not a perfect science, and we're very hesitant to use these monitors as a clear-cut indicator of who will revive and who will not revive after cardiac arrest resuscitation. Now, there's other things we could possibly use, and a variety of studies have looked at blood tests. So, for example, there are blood tests of general body health and function like blood lactic acid, markers of inflammation, that might be useful to show how injured a patient is after cardiac arrest. Also, there are markers of actual brain cell death itself. These are a blood test that will serve as markers to show how much brain death has occurred. So again, these things sound theoretically quite good, but just like with brain monitors, the research has been inconclusive. So again, over the last decade, many studies have been published looking at these things, but we do not have a clear-cut set of blood tests that we can use to tell a family member, your loved one will wake up, or it's hopeless, your loved one will be in a coma. And I wish we had those tools, but we do not. And so work is underway with both monitors and blood tests, and hopefully some combination of these may prove fruitful in coming years. You know, another method we could use to look at patients, of course, is the clinical examination. What do I mean by that? Well, we can look at pupils, we can look at reflexes, we can look at simple bedside tests of function to see who might recover. And while that sounds good, I want to share with you a scientific advisory statement put out by the American Academy of Neurology that, in a sense, throws cold water on this notion. After reviewing many studies on this topic, they concluded that within the first 3 days after a cardiac arrest, it's very hard to tell who will wake up and who will remain in coma based on clinical examination. What do I mean by this? Well, neurologists often use pupillary response and something called a gag response. These are reflexes that can be tested at the bedside as a way to tell irreversible brain death and or coma. These tests are not helpful or not accurate enough in the first 3 days following cardiac arrest to use as a definitive way of telling who will wake up. And even worse than that, and I want to share with you a direct quote from this advisory statement, current indicators of poor prognosis in comatose survivors are derived from patients not treated with induced hypothermia. That's the therapeutic hypothermia that we talked about in an earlier lecture. If this treatment becomes standard of care, that is hypothermia, these indicators may need revision. So note what they're saying here. This is a very important point, that most of the data surrounding prognosis after cardiac arrest was done before the era of hypothermia. Hypothermia has really only taken off as a therapy in the last few years. The science is evolving, and so with hypothermia, all bets are off. And this may scare some of you. It certainly scares me. We have had patients who we thought for all the world would never wake up, were comatose for a week or longer, and then woke up suddenly and went home fully functional. Now, it's not common, but it does happen. And to share with you a little bit of data on this, our research group and others have looked at this recently and asked the question, when do patients actually wake up? How long do we have to wait? And it's a little bit worrisome. In our hands, many patients actually take 3, 4, or even 5 or 6 days to wake up. What this means is they will be in a coma on a breathing machine for 3, 4, or 5 days, with their family getting increasingly worried, with the medical team getting increasingly worried, and sometimes they'll still recover. And what this really speaks to is an underlying important fundamental principle: the brain takes time to heal. It is a slow process, it's not a perfect process, and it's a poorly understood process. So what do we do in clinical practice, given this very murky picture I've just painted for you? Well, with all post-arrest survivors and their families in the intensive care setting, we urge caution, we urge patience, and we wait at least 72 hours. That's important. We counsel everyone to remain disciplined and say, for the first 72 hours, we just don't know who will live and who will live with brain dysfunction. And so we need to wait to see what will happen. And we have to remain humble. It's important that we counsel staff and physicians that we really don't know, that our blood tests and what we think might augur a good or poor prognosis are unreliable. And I have to give credit to one of my nursing coordinators who uses the following line when talking with patients, and it's really true. We often tell families, this is a marathon, not a sprint. What do I mean by this? Well, families are at the bedside, they're tired, they're stressed, and they're waiting expectantly for their loved one to wake up. And we tell them, you know what? This is going to take a few days. You need to go home, you need to rest, you need to sleep, you need to eat. The big decisions about your loved one's care are going to occur 2 or 3 days from now, not now. So don't burn out now spending all night in the ICU when this will take some time. So that's a very important message, I think, to get out there to the public about cardiac arrest survival and outcomes. So what do we do in our educational efforts? We urge all practitioners to wait at least 72 hours after cardiac arrest before making judgment. And this is easier said than done. We run an educational course, and I referenced this earlier, on hypothermia after cardiac arrest. And we talk to a lot of practitioners who say, well, in our hospital, they don't let us have 72 hours. We often make a decision at 48 hours whether to, quote unquote, pull the plug or not. And that worries me. And if I can do nothing else in this lecture series, I hope to impress upon you, the viewing audience, that you should lobby your hospitals and your sites to wait 72 hours following cardiac arrest before we decide if someone will not recover and not have meaningful survival. Now, it's important to point out, as far as these issues, there are other resources and organizations that support cardiac arrest survivors. We're not on our own in our counseling of families in this very difficult time period. There's the Sudden Cardiac Arrest Association, which is a nonprofit foundation devoted to cardiac arrest survivors and shares information and gets survivors to talk to each other, to share experiences, and also be a support network. In a very similar fashion, there's an entity called the Sudden Cardiac Arrest Foundation that is also a nonprofit group that works with survivors and works with schools and does educational efforts around cardiac arrest. 2 very important resources, and I encourage you to visit their websites and learn more about them. There's another similar group, but devoted specifically to parents of children who have had cardiac arrest, and that's called Parent Heart Watch. It's a very meaningful organization. Many parents have tragically lost their children to cardiac arrest, and they need all the support they can get, and this group is devoted to helping these parents heal or find meaning in their lives after the loss of a loved one. And sometimes in a happier setting, when their child survives the cardiac arrest, Parent Heart Watch helps mobilize their energy towards education and awareness for others to know about CPR and defibrillators and such. So these are three important organizations that we often turn families and their loved ones towards in these times of need. Another resource that we offer families is we've crafted a brochure about what to expect after cardiac arrest. We often find that families have a hard time listening in the first few days after cardiac arrest. They're tired, they're stressed. When we're all tired and stressed, we don't listen as well. So sometimes handing them something printed that has simple, clear language can be very helpful so they can refer to it. And those of you who are healthcare practitioners, feel free to download this off of our website at the Center for Resuscitation Science. We are happy to share it without copyright or charge or anything. You can take the text and do what you like with it. We just feel it's important to give families something so that some of their basic questions can be answered about what to expect. For example, that this will take several days to assess recovery.